So hello everybody, welcome to the IEP Live Learn Lunch. This is number 30 in our series. I can't believe that we've got to number 30 this quickly. We've got Paul joining us today from Greenbox First Aid Training, and we're going to have a very interactive and engaging session today. I've been really excited about this one, as those of you who attend regularly will know, because I've mentioned it every week, I believe. But before we get started with Paul, I just wanted to give you all a reminder about next week's Digital Technology Conference that we have running on the 16th and 17th of September. All the registration links are now ready for this, they're all available. So if you received your Learning Network emails this morning, they are all in there. If you haven't, please pop it in chat at some point during this session, and I will make sure I send that through to you. And it's got details of all of the fantastic speakers and responders we've got during the session. We have Lightbulb Moment, we have Joe from Lightbulb Moment joining us, we have Matt from the Digital College, we have Chris from JobSkiller, we have Pamela from PD Future Ready Learning, we have Erica and Lucy from Welcome to and LearnBox. We have the IEP Talent Academy, the Better Health Generation, Big Dog Little Dog, To Simply Learn, MZ, Skills Forward and Cognisoft, all coming together to support us on that digital technology conference. And it's all about how to use the digital technology we have within the employability sector. So I'd really encourage you to join us for that if you're available. But I've spoken about that for long enough. We're actually here today to see Paul and learn about how we can learn and deliver and practice first aid in a virtual environment. So I'm going to hand you over to Paul. As ever, if you've got any questions, pop them in chat and I'll be looking at that for you, and we'll make sure we've got some time for questions at the end. But thank you very much, and over to you, Paul.
Thank you very much, Helen, and welcome to everybody. As Helen said, my name is Paul and I run a training company called Greenbox First Aid Training. And over lockdown, we were closed down, so we had 3 months where we weren't able to deliver our face-to-face training. So we had to adapt to a virtual environment. I've got 2 boys that I was homeschooling, and we saw Joe Wicks do his his exercise classes online. And we thought that would be a really good idea to be able to teach children some basic first aid skills in our virtual environment. So we just converted our dining room, which we're in today, into a virtual training classroom. And we had to then deal with how we train people without the equipment, because I've got the dolls and all the expensive training equipment here, but without those in the home environment. So what we did was we adapted that, and we came up with 5 live shows where we taught children, and I think the adults gained some knowledge as well, but we did that very successfully over this period. So what we're going to do today is we're going to teach you some basic life-saving skills, and we'll show you the adaptations that we made from how I would normally train in a classroom environment to training in a home environment so that people can take part in this virtually. So first of all, when we've got a patient, we normally use one of these very expensive training mannequins, which lets us do CPR, and lets us do all of our checks on it. However, we don't have that, and as Helen asked you before, we've got you to bring forward your pillow and a milk bottle, and we'll show you what that's there for later today. Right, initially, when we're faced with a patient, we have to make a very quick assessment on whether that person needs our help or not. So we use a mnemonic, and this is used all throughout the medical profession. So the army use this, the police, the fire brigade, the ambulance service, and it really helps us to assess what we need to do with the patient. So it's called Dr. ABC. So again, very hook orientated. It should be very easy to remember. So doctor, so the D, we're going to use that as a word to remember. The first thing that you need to do when you check a scene is you need to look for danger. So we're going to have a good look around. Make sure, I mean, we generally know the really big things are dangerous, you know, moving vehicles, electricity, that sort of thing. But what I want you to have a look for is the really simple things, what you're kneeling on, where you're putting your hands, where your head is, and where your feet are. Make sure that the area is safe for you to approach before you do it. You can't help somebody when you hurt yourself. So we have a look for danger before we get involved. And then, to be honest, the next one you would do automatically. The next one is R, which is response. We need to check whether the patient is going to respond to us. So how we do that, and it's what you would do if you walked into a room and there was somebody on the floor, you talk to them. So we're going to check Bob here, and we're going to ask Bob to open his eyes. Bob, wake up, open your eyes for me. Give them an instruction, they're more likely to respond to you. Opening your eyes is the easiest, simple, physical thing to do. So give them an instruction, just asking them, are they okay? Might not get the response that you need. So we're going to give them a verbal response. If you don't get anything normal from that, then there's trouble. Okay, we need help now. So give a really big shout for help at this point. And then we're going to try and invoke a fear response from the patient. So I'm going to shout at them. Bob, open your eyes. Come on, Bob, wake up. Okay, that should, at least if they're in low levels of consciousness, get a jump. You should scare them. Okay, so if we don't get that, we're going to give a physical response. We're just going to try and shake them. So we give them a gentle shake of the shoulders, tap on the collarbone. It's pretty uncomfortable. And again, you might just get some sort of physical response from it. So we've now done our D and our R, so danger and response. And in first aid, we tend to think that when we do our Dr. ABC, it's purely for unconscious people on the floor. Somebody was choking, we need to make sure we're safe and we get a response from them. So everything that you do, remember your D and your R to start with. Now we're going to get sort of onto the technical bit now. We need to check, that person's unconscious, we need to check whether they're breathing or not. So your A is your airway, and your airway is the tube, the nose, the tube from the nose and the mouth all the way down into the lungs. So we may have a problem with that airway. First of all, it may be blocked. So I need to have a look at it. Okay. So to start with, I'm just going to have a look straight into the mouth and see if there's any objects in there. So it might be food, it might be that a child has put Lego in their mouth, or it might be vomit. So if we see anything in there at that point, don't start sticking your fingers in there. First of all, you'll push it further down, and you might get a bite reflex from the patient as well. So you might end up with a few fingers missing. So all we would do, if there's something in the mouth, when they're on their back, turn their chin towards their shoulder, just grab their clothes and roll them forwards, okay? And then all that will do is it'll allow it to drain out if it's vomit or something like that, or it will just fall to the front of the mouth and then we can flick it out if you need to, but we're not going to push it further back down. After we've checked their mouth and it's clear, what we need to do is we're going to put 2 fingers underneath the chin and on top of the head, and we need to open the airway. Now what that does, your tongue is a really big muscle. So when you become unconscious, it becomes all floppy and it flops to the back of the throat and can block it. So by just tipping it back like that, you're going to open the airway up. Okay? So that's now our danger, our response, our airway is clear. Now we've got to remember when we keep the airway open, make sure you hold it there because we're now going to use the B, which is breathing. So all I'm going to do now, I'm going to get my ear right down next to their mouth. And I'm going to listen and feel and look at the chest rising and falling to see if I can see breathing. Now, if I said to you I was going to show you a video of somebody that died already, they've been dead for 1.5 minutes, you'd expect that dead person just be flat, lying, quiet and still. Now, when somebody dies, their brain usually will function for a few minutes after they stop breathing. And you might get a movement from them. So you might see their hands moving, or you might hear kind of a noise like this. Like a gulping, snoring noise. And that's just the brain response to receiving very little oxygen. And that's not true normal breathing. What you're doing now is what we're looking for. If you don't get in those 10 seconds 2 normal quiet breaths, you're going to carry on to the C. Okay? So make sure that we check for 10 seconds by making sure that we've got the airway open as well. So we've now done our D, R, A, B, and now C. C means if you don't get those 2 normal breaths, we're going to call the ambulance. Okay, so 999 or 112, and you're going to start giving CPR. Okay, so that mnemonic really, really helps me. I don't have to think about it anymore. Check for danger, check for response, open the airway, check for breathing, no breathing, we call an ambulance, and then we're going to start CPR. So we're going to come to CPR in a little bit. Okay. So what happens if the patient is breathing? Now this patient is unconscious, and we've got to make sure that that airway is safe in case they vomit. So we call this the recovery position. So we would put somebody who is unconscious and breathing in the recovery position. I'm going to show you that now. If you do have another body, another person in the room, you can have a practice at this, or again, just have a quick look online and you can find the recovery position on there. So I've got a lovely glamorous assistant here. So Lucy, would you like to come and have a lay on the floor there? So I'm going to do this with my back to you so that you can see it from my point of view. But I'll talk very clearly about how we're doing this. So Lucy's unconscious, and so I need to turn her, and I'm going to bring her forward towards the camera. So first of all, the first thing I need to do is move the nearest arm out of the way. And then we're going to move the furthest leg up. Okay. Now I'm going to keep my hand on that, because if I don't, you're going to get this when they're unconscious. It's going to flop. Clothing is really, really good to get a good hold of. So if you need to get a hold of their clothing, it gives you a really good grip. Now what we need to do is I need to get hold of the other hand, because that's going to support Lucy's head when I roll her over. Lucy's got glasses on today. In reality, I would take those off. So I'm going to take a thumb-to-thumb grip. Not very helpful patient today. All I would do now is I've got a thumb-to-thumb grip. Very, very helpful. If this patient is a 17-stone guy, that arm is going to be really heavy. So I've got a really good grip on it. And I'm just going to put that down behind Lucy's ear. And now, what I don't want you to do is to start pulling with this arm, because if you do that, you'll dislocate the shoulder. And now I'm going to grab hold of this leg, and I'm just going to roll Lucy over with that leg. Okay, and you see, I've got her head, so it's not clattering on the floor. We just gently move my hand out of that. Always keep the patient's dignity. Make sure your leg is 90-degree angle up towards me. And then I'm just going to make sure Lucy's airway is open. And the biggest thing with this position here is if Lucy vomits, I want that vomit to clear. And if you can remember that with the recovery position, you'll always get that right. So look at them, and if you think that if they vomit, it will come out of their mouth, that's your recovery position, because their tongue is naturally off their mouth at this bit. Fabulous. Well, that's the recovery position. So thank you, Lucy. All done. You can have your glasses back. Right. So that is the recovery position. Now that might be enough to save that person's life. Okay. You're protecting the airway, and just vomit happens quite a lot when people are unconscious. So again, it's very, very important. Kids, it's not about strength. I've taught children as young as sort of 4 or 5, and they can move an adult by bringing that knee over and making sure that they can roll them. So it's very, very simple. It's not a physical activity, that one. Brilliant. So that's by doing our doctor. So D-R-A-B-C. And that was what happened if they are breathing. We're going to have a look now about what happens when they're not breathing. And this is going to be our first kind of adaptation with the equipment that we've got. So traditionally, we've got Bob in our first aid classes. Now, Bob's really great because it means I can do CPR. This Bob is even electric. So he gives me feedback on a little screen about how CPR is going. And also it allows me to do the breaths as well. Which is great. You know, that's what we would normally use in a first aid class. However, you guys at home, you don't have these, and people that we've been teaching at home, they didn't have those. So we have to create a way of feeling the same resistance and going through that physical motion so that they can remember what to do. So here we come with a pillow and an empty 2-litre bottle of milk. Make sure that the lid's on nice and tight, because we want that to be quite firm. So normally, if we just use a pillow to try and do CPR, it's not going to work. It's too soft. I wanted you to have a feeling of resistance on the chest there. So all we're going to do here is I'm just going to put it at the bottom of the pillow, right in the middle, inside the pillowcase. And now I've got my resistance, okay? That's going to feel much more like the doll. And so what you can do at home, and as I've spoken to Helen about this, you know, I train lots of people in the workplace. And it's great. We do the course with them. They have lots of goes on the dolls, and we practice it. However, that certificate will last for 3 years. Now, there's no way that your brain can keep that knowledge, you know, as good as it was when you left the classroom. So practice is really important. But people tend not to practice because they don't have the kit. They think they can't do it. This is a perfectly good alternative to it. So all we're going to do now is I want you guys at home have a walk through me with your Dr. ABC, and then we're going to have a look at CPR. So D is that we look for danger. R, we're going to check for response. So Bob, wake up. You need a bit of imagination here. And then again, we're going to shout at him. Wake up, Bob. Come on, Bob, open your eyes. And then we're going to try a physical response. So again, we've got a cushion, we can do a physical response on that. Now the airway, we're going to have to imagine that, okay? So what we do here is we open the airway, but again, we can still get our ear right next down to where their head is. We did this with scouts, and we did it with a t-shirt that was stuffed with clothing, and we even put a balloon on the top. So you can actually put a head on this as well if you want to make it a bit more realistic. We've done our danger response, airway, breathing. We've done our breathing check for 10 seconds. We've not heard the 2 normal quiet breaths, so we call the ambulance at this point. Now we're going to ask if there's a bystander around with you. They can make the call for you, but we also want them to get a defibrillator. Now a lot of people are scared of defibrillators. Defibrillator is something that will get the heart back into a normal rhythm. We're going to have a look at those in a second. So danger response, airway, breathing. We've called for help, now we need to do CPR. Now, where we push in CPR, right in the middle of this hard part of your chest, okay? Right in the center there, okay? So if you have a press at home now, you'll feel that it's really, really solid. This bone is there to protect your heart from anything banging it, so you have to push hard. So how we do that, we're going to use your body's skeletal strength, so the strength of actually how it's made, instead of your muscles, and we're just going to interlock your hands, and I'm going to put the heel of your hand right in the center of your cushion there, and you should feel some resistance with the bottle now. And what we do is we're going to compress the chest a third of the depth of the body. Okay, that's good because it means we can adapt it to any size of person. So all we do is put hands in the center there, lock your elbows and lock your shoulders, and that means you're not relying on your muscle strength, you're relying on the strength of your shoulders coming down, and it will go directly to your arm. Now we want to do 30 of those, so we're going to do 30 compressions, and then we'll have a look at what we do after that. So, and the rhythm, now there's a lot, when I normally do first aid classes, there's lots of songs being sung at this point, because people have heard that I learned with Nelly the Elephant. The popular one at the moment is Staying Alive, the Bee Gees, because it was on one of the Vinnie Jones advert. The rhythm that we're after is between 100 and 120 beats per minute. And so it's pretty quick. 120 beats per minute is 2 every second. So we'll do those now. Have a go at home with these as well. So we're going to go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, so we've done our 30 compressions, okay? It's really hard work, okay? The maximum that we recommend that you do of this is 2 minutes, okay? We need, if there are bystanders there, we need them to come in and take over from you. Even if they've not been trained, they can come and do that for you, because you'll just show them what to do. Don't get a hero complex and try and do this for 8 or 9 minutes if there's an option. Obviously, if you're on your own, you're going to need to go as long as you can. So we've done our 30 compressions, and now we need to do the 2 breaths. Now, I will revert to this just to show you how this works on the dog. So you need to do 3 things. We need to pinch the nose. If you don't close the nose, when you breathe into that mouth, whatever comes out of that nose is going to come straight back at you. So we pinch the nose. If you remember about the airway, we need that to be open, so we're going to rock the head back. And now I need to seal around the mouth. So we're going to make an airtight seal around the mouth just to enable the air to be pushed in. And we put 2 breaths in, and you see it's all box chest rising there. So I'm always looking at the chest to see if it goes in. Now we've got 10 seconds between stopping the compressions, doing the breaths, and then jumping straight back onto the chest again. The chest compressions are more important than the breaths. So if you don't get one of those breaths in, don't do number 2, number 3, or number 4. And now all you will do is you just jump straight back on the chest again. And we'll do 30 compressions, 2 breaths, 30 compressions to 2 breaths. Now, one of the things that we looked at was D for danger. Now, obviously, we're in very strange times at the moment with COVID-19. It's actually made our life easier as a first aider because we don't do the breaths anymore. So what you would do is exactly what we were doing, just with your pillow. We're not going to do the breaths. All we would do, actually, to make you safer, is we would cover the face with a t-shirt or a piece of clothing. You could even get the patient's clothing and just put it over their face, Just when you push on their chest, you're going to get air coming out of their lungs, and that's the danger to us as the first aid. Makes our life a little bit easier. So the difference with COVID is when we do our check, so we do our danger response, but all we do from that distance is we do it from afar. We don't get anywhere near their face. We're not going to check their airway during the COVID times because, again, that's the danger to me. And the breathing is done from a visual check, just looking at the patient. So there are our adaptations. Actually makes our life a little bit easier because there's less for us to do. So all we would do, you don't need to count to 30 if you're doing compression only CPR. All we would do there is just count to 4. So it keeps your rhythm. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. Now, when we're pushing down, we are now the heart. So the heart is a big squishy bag of blood, and what we're doing is we're squeezing the blood out and we're letting it refill, and squeezing it out and letting it refill. So on a real person, make sure that the chest comes all the way up. What we don't want to do is do that, okay? Because you're just not going to let the heart refill as well. So the compression and the release is added. And that's how you do CPR. It's just a case, keep pumping on the chest until the paramedics arrive, or a defibrillator arrives as well. The great thing for us as first aiders is that we never get to choose when we stop doing CPR. I quite like that because you're not making a very difficult decision. The only times that we would stop doing CPR is if you're told to. So if the paramedics tell you to stop, you stop. If the patient tells you to stop, which is great, you stop. And the only other time is when you can't continue. That might be that you're too tired, or that the situation has got dangerous again, and so therefore you can't continue because you're worried for your own safety. The great thing is we never ever get to do that. Now, just a little thing with children. Children and adults die in a different way normally. Now, an adult, normally their heart will stop first, and that means that there's lots of oxygen sitting in their body. So when we start with doing compressions, we're moving blood around it, which has got oxygen, which feeds it to the brain. Now, children, normally what happens is their lungs stop first, and their heart will keep beating until it uses all of their oxygen, and then the heart will stop because it's got no oxygen. So with children, it's very important that we do the breaths. And the guidelines with COVID are still saying that with children, and where we're talking under puberty, that they still need breath. They've looked at the risks of those children having COVID, and our risk of giving CPR, and they've said it's still worth doing. Now, with a child, what we're going to do is we're going to put 5 breaths into the child first. So all we would do, instead of starting with compressions, 5 breaths. And then we're going to start on it. Now, the only problem is if you're a big adult and this is a small child, you are going to damage them. So what we say when we start doing compressions with a child is we're going to use one hand to start with, and obviously we make the compressions appropriate for the size of the child, because we're still going to compress a third of the depth of the body. Now, I get a lot of people on the courses that say to me, we're never going to remember whether it's breaths first or compressions first. Now, the way that I have this stored in my head, I'm dyslexic, and I find the patterns difficult to remember. What I do is I just remember everybody is 30 compressions to 2 breaths. Kids, 5 breaths first. And in my head, that's very simple. Everyone's 30 to 2, kids 5 breaths first. And that really, really helps me remember doing that. Now, babies. Babies are under 1. And here we go, we've got a little baby here. And again, you'll still be able to do this, the children's compressions with your pillow. And also the baby one as well. Now the baby, their airway is a little bit different. Their airway is a little bit like a drinking straw. So if I bend a drinking straw, it goes like that and it will close. So I don't want to tip the airway all the way back on the baby. Now, they've got a big gap in between their head and their shoulders. And so what we would need to do, a nappy or a baby grow just underneath there will really, really help the situation here. I could just use my hand today. So I'm just going to support the airway there. And again, we're going to put 5 breaths in to start with. These are just little cheek blows like that. Now, if it's a newborn, you're not going to be able to pinch the nose and seal the mouth at the same time. So it's okay just to get your whole mouth, put it over both the nose and the mouth, and that will just seal the airway in as well. All of these, we do the same checks before we start. So DRABC. So your Dr. ABC, danger, response, airway, breathing, by CPR. So with the baby, I'm just going to pinch the nose. This one's a little bit too big for me to get my mouth around. It's on 5 little cheek blows. And again, just to resist the force, all my force going through the baby, I'm just going to use 2 fingers in the center of the chest. And now we just do 30 compressions to 2 breaths. Okay? Really, really pretty straightforward. Just remember that everybody's 30 to 2, it's 5 breaths first. But to be honest, if you take, these are all guidelines, if you take more than 40 seconds thinking about which one you should do, you should just start something. We're holding off for too long. Good. So that's CPR. There, we've done already just in half an hour. You've learned the recovery positions, which we put people when they're unconscious and breathing. And you've learned how to do CPR on adults, children, and infants as well. The big thing here is to practice. So if you can walk into a room with your cushion with the bottle on it and do your Dr. ABC, and then you do your checks, and then it's straight on, and we start it. If you can do that once a month, or do it with your children, or do it with your partner, it will really become ingrained in your brain. So when you have to deal with this in an emergency situation, which you're unlikely to do, it will really, really help. The thing is, we don't do it all the time, so practice is really, really important. Now, so that's the first aid for today, but I just wanted to show you again just a couple of things that we did with the group, just so that you can adapt. We've got some people that hate virtual training because they don't think it's as good, whereas really changed my opinion since lockdown about how we approach it. I just think that if you go into training with an open mind and just look at what we're trying to learn, you'll do really, really well, because it can be as effective as face-to-face training. Now, but we talked about defibrillators, which I have. Really, it's a nice expensive training model, which we turn on and it will start talking to me.
Training scenario.
And
1. Adult patient.
It will start talking to me.
Call for medical assistance.
And all we need to do is listen to the defibrillator. They're really easy to use. And then we get the students to put the pads on onto here, and we do that. Okay? And they're just going through the motions, so if they ever need to do it, it's just not alien to them. I like to do everything practically as we can do. Now, so what we did, obviously the people at home didn't have these expensive defibrillators, so we got them to make one. Just from a box, some string, a couple of pads that are paper. Now, the actual mechanism of doing what we needed to do is exactly the same. We just used some sellotape on the pads. I learned this from the live lesson, that you don't pre-do this because they lose their stick. So we're just going to get some double-sided sticky tape. So just roll it round. And there we go, there's one sticky pad on there. And there's another one on there. So again, we just got them to do their Dr. ABC to start CPR, and then we've got our defibrillator box there, which we put directly onto the doll. We got the young children to use teddies instead of cushions like we've done with you today. You've got a bit more strength, so I wanted that resistance of the milk bottle. And then we just went through the whole procedure, and they drew buttons on the defibrillator, and we got them to press it when it followed the voice commands of the real one. So again, it's absolutely the same product, but just done in a slightly different way. And just for our last one, this one went down really, really well. And it always does in our training, and it's what I really, really wanted to replicate. Now, this is called a choking vest. So we get our students to practice getting an object out of this choking vest, which has got a tube here, and there's a dart, a foam dart in here. So I put this on, and the students come and practice. And what they do is they put their hands round behind me, they put their fist into their tummy, and if you watch the dart come out, it comes flying out. And I love that. And I just think that the adults love this. They think it's really funny, but it's very memorable. And that's the big thing with training, is to make it memorable. Now, we didn't have that. There's no way I could, there's no way. That was probably my biggest challenge in the whole of lockdown, was to make something that did that. So what we did, this might look a little bit more basic, but the whole thing of how we train choking is that your lungs are a balloon which have air in it, and there's an object in the airway which we've got to pop out. So what we did was we got a loo roll, we got a little sandwich bag, and we got some normal parcel tape there, and some loo roll itself and scrunched up. So what we did, we got the children just to blow into the bag, filled it up, we put the object in there, and we got them to squeeze it. And it does exactly the same job. So in the children's mind, we've got the idea that you squeeze their lungs, the balloon, and it will get that object out there. So that was one of the other things that we did there. We did quite a few other things with showing them models about how the body works, just using household items. But again, if you're approaching virtual training, one of the big things that I'm passionate about with Helen is that it can be as effective. You will learn the same skills from a virtual environment than you will do from some face-to-face training. We still love the face-to-face training, but it can work both ways. So that's me. That's everything I've got to tell you today. So I think Helen has got some questions for us today.
Excellent. Thank you so much, Paul. And I've been nodding my head at so much of that, and that looked fantastic. I'm going to, as soon as my daughter gets home from school, we are going to make one of those compression things with some loo rolls. I've collected all the loo rolls over lockdown in order to save them to do some sort of craft with. So I'm going to do a really useful life-saving one with her, because I think it's more useful than what I possibly had planned. And we've got another visitor.
That was our best one, I think. That was what I was most pleased with. So we got some questions today.
Excellent. Well, we haven't had any come through yet. So guys, and as I suspected, because people were watching that and it was absolutely fantastic, none have come through yet. So if anyone has any questions about anything to do with first aid for Paul, pop them in. In the meantime, I'm going to ask a question. You mentioned earlier that at the moment, the advice is that we don't give compression breaths for adults during COVID, which is completely unsurprising. I'm just wondering what the impact is on the patient. You sort of mentioned that adults have more breath in their body. So what's the impact of that change in advice?
It was always a question that I get asked a lot, even prior to COVID. It was always a question that I got asked whether the breaths made much of a difference. And to be honest, looking at the statistics, in a first aid environment, the breaths do make a difference, but not a huge difference. I mean, just to give you an example, the world record for holding your breath is 24 minutes. So it just shows you how the body can actually survive without taking oxygen in. Now, that's obviously a trained person that's practiced that. However, there is a lot of oxygen in the system of an adult where their heart stopped first. So it's not made a huge difference to the survival rate. One of the big difference that COVID has made to the survival rate is the response time of the paramedics coming in and putting their PPE on, because we need them to, you don't have an indefinite amount of oxygen, but we're always waiting for the paramedics to come in and do that for us, but they're taking longer to get into the environment now, which is, so I would imagine since COVID, the sort of the rest, the cardiac arrest that happened outside of hospitals, I would imagine the survival rate has gone down.
Oh dear. Okay, so we have got some questions in now. That's fantastic. So first question, Nicholas said that was fantastic. Thank you, not only for a refresher, but for the new skills. So some great feedback there. Janine has asked, she said, this has been super. She said, could you go through again where on the chest we put the defib pads?
The defib pads, yeah. I always remember this. Easiest one to remember is it's in the driver's seatbelt position. So we put it the right chest, and the one that people get wrong is the one that they tend to put it here, but it needs to go where the bra strap goes on the side there. If you think electricity is going to travel in a straight line, and if I put it there, it will just go across the chest. So we need it to go down towards the heart. So we put it on the side there. Now, the great news about this is that, and I'll put this up to the camera, is that the pads have really, really clear pictures on them about where you put these. So I'll just show you so that you can see. So even if you hadn't used one of these before, you would be faced with that. So that's going to give you really, really clear instructions about where to do them. So the great thing with the defibrillator, and I tell this to people during training, is actually when you've had some training with the defib, sometimes it can be detrimental because you try to relate you try to rely on your training, whereas all we want you to remember to do is to turn the defibrillator on and then do as you're told, which is very difficult for us as adults, because I definitely don't like doing what I'm told. But it's much better to rely on the defibrillator than to rely on your knowledge, because in a stress situation, this thing will take over for you. So yeah, really, really simple.
Fantastic, thank you very much. Louise has asked around bleeding and fractures of bones. What are there any sort of advice you can give us about how we deal with these?
Bleeding is pretty straightforward. So all we do, we've got kind of a staged approach to this. So first of all, make sure that you sit them or lay them down so that they're not going to fall over. One of the first rules of first aid that I always say to people in the classes is sit them down before they fall down. Get them on their bum so they're not going to do themselves any more harm. Now, the second thing that we need to do is we need to have a look at the wound just to make sure that there's nothing in it. Also, I need to check where it's coming from. I know that might sound very obvious, but when people have got clothes on and they're bleeding, the point of blood that you see might not be where it's coming from. A decent pair of scissors in your first aid kit is always good. And I need to see what, I know this sounds ridiculous, but I need to see what type of blood it is as well. We have 3 different types of bleeding. If it's spurting out and it's bright red, it's coming from the arteries in the body, and that's really serious. If it's dark red and it's flowing out, it's coming from your veins. And if you get kind of, we call it capillary bleeding, but it's a graze, or if I cut myself shaving, trickles out, that's pretty easy to deal with. So sit them down, make sure that you have a look at the wound, and then the key to stopping bleeding is to put pressure on it. These are your bleeding control kits in your hands. Ideally, get some gloves on and get some pressure on it for at least 10 minutes, and then we should control the bleed. I think one of the things that I face a lot in first aid classes is people think horrendous wound, and they think about the consequences to the patient, i.e. they're going to need an operation, they're going to need stitches. Just remember your role in first aid. We are just there to stop it bleeding and then to pass them on to the professional. Don't overthink it. With breaks, really, really simple. We use one word: immobilize it. Keep it still. So if every person that I've dealt with a broken bone, when I've got to them, they've made themselves comfortable. So it's just my job just to keep that limb or whatever it is, digit, in the same position that it's in and get them to hospital. Generally, with their upper body breaks, we're going to ask if we can to get them in a car or a taxi and get them to hospital. They'll get there quicker than if we call an ambulance. But the lower leg, broken legs, we can't move them without making it worse. So we can call an ambulance. So a couple of quick tricks. I don't teach slings in first aid classes because we never remember them. I'm very lucky. I carry a sling around with me every day, pretty much. So I've got, there you go, that for a sling. If you've got a safety pin at home and you've got a long sleeve top, all you would do is just pin the top to their jersey, and that creates a sling for you. And the other one is if they've got a t-shirt on, all we do there is we just lift the bottom of the t-shirt up, put it over the arm, and then pin it there, and that will create a nice sling. Well, I find that we talked about people not practicing things enough. Slings are one of the things that we don't want you to go into half-cock, just because you will move them and you'll make that worse. So just supporting the clothing. But yeah, pretty straightforward.
Excellent, thank you. So Anila said thank you very much for the information, well, she said for the question about bleeding and the information, and she's also said that it's been really useful and she's going to use this stuff with her children when they come home. Now it's an interesting point that I was going to mention at the end, but please do, if you check out Greenbox First Aid's YouTube site, you've got all of your videos from when you did the sessions with the children over lockdown, don't you?
Yeah, and we pitched the videos. When I teach children, I don't talk to them any differently than I do adults. I just use a simple language, but I don't dumb it down. We tell them exactly how it is. And for the people that are here today, if you want to retain information, the best way to retain information is to teach somebody else. If you can do that, you'll really, really remember the information. It's a really great way of learning, is to actually to do it, to teach somebody else. And I use that in first aid classes. We use peer-led training, where they help and assess each other. And again, it's just another way of getting the information there. And kids love it. I mean, there's so many great heartwarming stories about there where children have saved their parents' parents' lives just by knowing how to call the ambulance and putting them in the recovery position and knowing it's okay to let the ambulance do it to their house. So that's a great idea, really, really good.
Brilliant. So we have one last question at the moment and then another comment. So Louise says, how many times can you use the defibrillator?
So a defib, we use it probably I'll answer that in two different ways, just so we make sure we get the right answer. The defibrillator, what it will do is we'll put it onto the patient and it will run through a cycle and it will check what's going on with the heart. If it wants you to shock them, it will say administer the shock and we press the button. And then every 2 minutes, it will go back and it will go through the same process. So 2 minutes later, it will tell you to stand away from the patient. It will say checking for a heartbeat, and then it will allow you to shock them. These will deliver up to 300 shocks. So if you think that we're going to wait probably the most in this situation 10 minutes, that's only 5 shocks that it'll allow you to do. But it will go up to 300 shocks. And then what happens is the paramedics will take the defibrillator away with the patient. That will go away, and then to use it again, it will need to have a battery, a new battery, and it will need new pads. But the defibrillator itself, will stay the same. It's just the pads and the battery that will need single use only. You can buy these, and they have a shelf life of about 8 years. Some of them before they need things replaced. So they're getting much more affordable and much more user-friendly as well.
So they have them in various locations now, don't they? And I believe in one of the sessions you did with the children, you helped them build an understanding of where they could find them in their local area should they be needed.
Absolutely. So we normally find these in yellow and green cabinets. Now, I have seen them where they've been red, but they're normally yellow and green. And if you see a sign that says AED, it's a simplified way of saying defibrillator. It just means automated external defibrillator. And have a look for them out in your local environment. I know here in Windsor, we've got 10 in the town centre alone. They're in a lockable cabinet, and they'll have clear instructions about how to use them. Now, the only thing I've got to remember is if I send a bystander, that they'll need their phone, because they'll need to call 999, and then they'll need to give the call operator a little digit, a little sort of code on the box. And then the call operator will give them the code to get into the box. They're all locked away. It's like a security cabinet. But yeah, really easy. We just need to remember a phone.
Excellent, fantastic, great advice. So we have a couple more comments. We've had Janine and Sylvia both saying the session's been amazing and great, and thank you. And Ian has said that this has been a really quality bite-sized training session. Excellent, thank you. So I think that's a nice comment to finish on.
Brilliant. Well, thank you very much for joining us today. It's it's been really enjoyable. Helen, I've really looked forward to this for a long time, so it's really nice to get to it.
It has been. Thank you so much, as I've said. So thank you very much. It's been wonderful, and as ever, I've learned something. So that's fantastic, brilliant. So with that, then, unless anyone's typing any last-minute questions into the session, I will say thank you very much to Paul. This session will be on our YouTube channel later, so do feel free to mention it to your colleagues and encourage them to watch it as a refresher. A lot of us have been out of the workplace for some time now, so these refreshers I think are really, really useful. And again, this idea around muscle memory is really key, we know, so having ideas as to how we can practice some of these life-saving skills at home or in the office is fantastic. If you haven't registered for the Digital Technology Conference rather, please do so. As I say, you can get in touch with me and I can send you all those links for the registration details, and we look forward to seeing you on some of the future Live Learn lunches. We have over the coming weeks some more coaching sessions coming up. We have some specialist advice from career mums around supporting mums in their return to work. We have fitness session plans, and we also have in a couple of weeks another CPD through change session plan. So lots coming up over the coming weeks, and thank you once again everybody for attending the session, and a massive thank you to Paul from Greenbox. And of course you can all get in touch with him at the details that are on screen, and they'll be sent out later with the links should you require any training, whether that's face-to-face or blended training in the workplace. Thank you everybody, and goodbye. See you again.